Dr. Paul Mason, Arrogance in the Medical Profession is a Challenge to Our Health, from the HVMN YouTube podcast, March 2021.
There's a problem where we have something called eminence-based medicine, and that's totally contrary to evidence-based medicine. Evidence-based medicine means we look at the data, we draw a conclusion. Eminence-based medicine means that we put our trust in other people, not the data. We actually allow eminent people, experts, if you will, to provide us with their conclusion because they're clearly smarter than we, and we can accept at face value everything they say. So there was a paper from the American Diabetes Association, which is very, very heavily cited, and it's on the use of statins in diabetes. And I had a lot of people tweeting this paper at me and emailing me this paper and saying, see, this proves that statins are good in diabetes. I went and looked at the references. There were 6 references on this paper. 3 of the references did not include all-cause mortality as a measure of outcome. That is, they didn't actually ask the question, let alone answer the question, whether taking statins for patients with diabetes made them live longer. The 3 studies that they included that did actually ask the question about all-cause mortality, they all had insignificant findings. Not one of the references in this paper showed what they said it did. And yet, this is a very heavily cited position statement from an expert body that recommends the use of statins in diabetes. And this is just madness. And if people actually understood that the wool was literally being pulled over their eyes, you can't trust the conclusion, you can't trust these guidelines, you can't trust these expert bodies. You have to look at the raw data. When you look at the raw data, the truth is very, very different. I don't think there's any ulterior motives on the side of doctors who are making these conclusions. I think it just comes down to pride and intellectual arrogance. They're used to being the smartest people in the room, and they really don't want to concede that they could be wrong about anything. And I mean, I can speak to this from personal experience because I haven't always been an advocate of low seed oil, low carbohydrate, ketogenic style diets. I used to be, lock, stock and barrel, straight down the line, making these recommendations that people eat low fats on and so forth. And I was absolutely adamant in that. And the position I was coming from was supreme confidence that I'd had an academic education and therefore I was right. I just hadn't even considered the possibility that I was wrong because I trusted the people who had taught me. I get excited when I read a research paper where they actually find against their original hypothesis and they report it clearly as such. There was a paper from the American Journal of Cardiology in 2004, and they predicted that saturated fat would increase LDL oxidation. So just to make very clear, LDL, low-density lipoprotein, which is often pejoratively and incorrectly referred to as bad cholesterol. So LDL in and of itself is not harmful, but if that LDL becomes damaged, and one of the ways it becomes damaged is through oxidation, then it can contribute to what we call the atherosclerotic burden or plaque, basically lining your blood vessels. So this paper predicted that if people had more saturated fat, they would have higher oxidation levels of LDL. And in actual fact, they found that it was polyunsaturated fats or vegetable and seed oils that did this. And in their conclusion, they stated, these experiments provide convincing evidence that our original hypothesis was not correct. Clear, unambiguous language. And I think that is just fantastic science. That is how science should happen.
Evidence-based medicine means we look at the research data to draw conclusions, while eminence-based medicine means we trust the experts. For example, an American Diabetes Association paper on statin use with diabetes had 6 references. 3 references did not include all-cause mortality as an outcome. 3 that included all-cause mortality all had insignificant findings. Not one reference in this paper showed what the authors said it did. And yet this is a very heavily cited position paper by the ADA, which recommends using statins for diabetes. The wool is being pulled over our patients' eyes, says Dr. Mason. You cannot trust these conclusions, these guidelines, these expert bodies. The data only will show the truth. Dr. Mason believes that the medical profession, it's really not ulterior motives by doctors, it's just pride and arrogance. For example, he says, I have not always been an advocate for low seed oils, low carb diets, ketogenic diets. I used to recommend the standard low fat diet, etc. I had supreme confidence that I had an academic education. I didn't even consider that I might be wrong. I trusted those who taught me. I get excited when I find an academic paper which has results that find against their own hypothesis and actually report it clearly. For example, in the American Journal of Cardiology 2004, the authors predicted that saturated fat would increase LDL oxidation. LDL, which is incorrectly referred to as bad cholesterol, this has been proven to be false. Only if LDL becomes damaged, as in oxidation, then it becomes bad cholesterol. It contributes to blood vessel plaque. The American Journal of Cardiology 2004 paper predicted that saturated fat would increase LDL oxidation, when actually they found that polyunsaturated vegetable and seed oils cause oxidation. In their conclusion, they stated, our original hypothesis was not correct. Dr. Mason says, this is an example of fantastic science.